She went to the ENT, and for 2 months she was taking antibiotics without any success until she finally saw the dentist, and we found something that sadly happens a lot in medicine. Unfortunately, there are some ENTs who still aren't seeing the patient as something organic, as something complex, and they want to solve all the problems that happen in their areas without looking at the others. And this was the case with our patient. Our patient says she started having discomfort when she bent over. She felt like pressure up here. She had some allergies. Suddenly she had like a runny nose on one side. So she went to see the ENT. The ENT put a little camera in and said, "You have rhinosinusitis, so we have to give you an antibiotic." There were no x-rays, no CT scans. It was just the image he saw with his little camera. So he prescribed the course of antibiotics. However, after 2 months, more or less, a month and a half, she started again with the exact same discomfort, even a bit stronger. She went to see the ENT again. He told her, "Geez, I think the antibiotic wasn't enough. We have to give you another stronger antibiotic." She felt better again for a while, but she relapsed again. The third time she went to see another ENT, he immediately told her, "Look, it's only on one side, it's swollen on this side not so much. You have to go see the dentist because it could be something that doesn't just come from the nose." And indeed, when she came to us, we did a dental CT scan. 5 minutes of reviewing the scan, we found what is an odontogenic sinusitis. There are two types of sinusitis in this case we're discussing. One is rhinosinusitis and the other is odontogenic sinusitis. What's the difference? Rhinosinusitis comes from bacteria, viruses from the respiratory tract that are stored in the maxillary sinuses and can get infected, and is totally independent of the teeth. However, there's something called odontogenic sinusitis, and as its name indicates, it comes from the tooth. What happens? If you have a tooth that's very close to the maxillary sinus and this tooth gets a cavity, it gets infected, this infection crosses the Schneiderian membrane, which is the one that lines the maxillary sinus, and infects the sinus, and has symptoms similar to rhinosinusitis. But the difference is that this one comes from the tooth. If you give antibiotics to this one, it'll work very well. To this one, you can give antibiotics too without any problem, and it'll work very well, but there's one thing that's not being seen. What was the original infection? On this side, the original infection was a virus, a bacterium that entered inside the maxillary sinus, but your own body will take care of clearing this infection. However, here your defenses work the same. The antibiotic will work well, but the origin wasn't a mucosal origin, it was a tooth origin. Therefore, if you don't treat the tooth, this infection will start all over again. In fact, it's one of the most common mistakes in dentistry, giving antibiotics for an infected molar without doing any treatment. So if the tooth is restorable, we can do a root canal to try to save this tooth and keep it in the body. However, there are many teeth that, because of the cavity or the destruction, are no longer restorable, and we have to remove them. So the treatment is either a root canal, as I said, or an extraction.